Hello everyone, this is Dr. Rohita. I'm consultant gynecologist and fertility expert, Motherhood Hospital, Hennur, Bangalore. Today we are speaking about polycystic ovarian syndrome. Polycystic ovarian syndrome is a generalized disease which occurs when ovaries produce excess hormones called androgens. Androgens are male sex hormones which when produced in excess causes your reproductive hormones in disbalance. What age does the PCOS start? PCOS start as early as puberty. Most people come to us at their 20s or 30s when they are trying to get pregnant. How common is PCOS? PCOS is very common in Indian population. 1 in 5 women have PCOS. What are the symptoms of PCOS? Irregular periods or not having periods at all, abnormal hair growth on your face, chest, abdomen and arms, acne especially on your chest and back which are resistant for treatment, thinning of hair especially in the central parting in females, skin tags also called as acrocordons especially around your neck, and velvety discoloration of skin at the nape of your neck and armpits. Can I have PCOS and not have any symptoms? Yes, it is possible that you have PCOS but not have any symptoms. Most people don't even realize that they have PCOS until they are trying to get pregnant or hard to conceive. Sometimes they have milder PCOS where the symptoms are not severe enough that they require treatment. What is the main cause of PCOS? The cause of PCOS is not known. Genetics might have a role. Insulin resistance creates a vicious cycle for the development of PCOS. PCOS people often have low-grade chronic inflammation going on in their body. Is PCOS genetic? Yes, PCOS is known to have a genetic predisposition, especially if your mother is PCOS. PCOS is known to run in families, especially in sisters. Can PCOS affect your pregnancy? PCOS women who get pregnant are prone to develop complications like gestational diabetes, preeclampsia, chronic hypertension, and more prone for preterm labor and cesarean section. How is polycystic ovarian syndrome treated? Treatment includes lifestyle changes, medications, and a combination of both. Treatment also differs based on age. Lifestyle changes include eating nutritious diet and exercising regularly. Both strength training exercises and aerobics are important. Next, coming to drugs, there are many drugs where we give to regularize your menstrual cycles and regularize your insulin levels. Birth control pills regularize your hormones and menstrual cycles. Insulin sensitizing agents like myoinositol and metformin helps regularize your insulin and breaks the vicious cycle in the PCOS disease. So what is the treatment for PCOS who are trying to get pregnant? For those who are trying to get pregnant, we induce ovulation by giving oral drugs like clomiphene citrate and letrozole from day 2 and day 6 of menstrual cycle. If they do not respond to oral drugs, next option is gonadotropins where we give by injections. Next option, those who do not respond to either oral drugs or injectable gonadotropins is either surgery or in vitro fertilization. In surgery, we have options like laparoscopic ovarian drilling, which helps to restore ovulation by cauterizing the ovarian tissue. And lastly, we have in vitro fertilization for those resistant and difficult PCOS. Does PCOS ever go away? PCOS is a lifestyle disease. It cannot go away, it cannot be cured, but the symptoms can be managed by using drugs. Can I get pregnant if I have PCOS? Yes, definitely. You can get pregnant if you have PCOS. Most women have trouble conception, but at the same time, many women conceive on their own. Does PCOS put me at risk for any other health conditions? Yes, PCOS is known to raise the risk of several health conditions like diabetes, hypertension, chronic cardiovascular disease, sleep apnea, endometrial hyperplasia, endometrial cancer, depression and anxiety. Thank you.
Motherhood Hospitals. We care like no other.